This is a 6-minute video to update you on the impact of COVID-19 on the Open Door Family Medical Centers. Lindsay Farrell, President and CEO. First, the statistics. We've conducted more than 1,900 tests and have identified 853 people sickened by the coronavirus. Our positive case rate is 49%. 37 staff members have tested positive, while 83 have tested negative. We have more than 30 patients hospitalized. I'm happy that several are now convalescing at home, but sad to tell you that 6 Open Door patients have passed away in the last 3 weeks. Open Door's frontline healthcare workers, doctors, nurse practitioners, physician's assistants, nurses, medical assistants are all doing an amazing job. And it's important to say they are putting their lives on the line each and every day. Indeed, our thoughts are with our hospital colleagues who are bearing such an incredible burden at this time. Open Door's facilities have been reconfigured to completely separate COVID care from our regular services, which we've really had to limit. We are only providing emergency dental care. We have very limited pediatric and women's health care. The majority of our behavioral health care is being provided over the telephone through virtual visits. There are some patients that we do need to see and who we must care for in person, but that is the exception and not the norm. We've sprinted to telehealth, and we are working hard to adapt to this new modality. More about that to come. COVID-19 has presented numerous challenges to our workforce. We've had many staff opt for FMLA, while we've had to furlough others. 130 staff members out of nearly 500 are not working. Others are working remotely to the extent that their jobs allow for that, and they have a setup at home. COVID-19 has negatively impacted our finances. Revenues had dried up as our high-volume medical practice has shifted to COVID care. I'm happy to report that we've received funds in several tranches from the CARES Act, thanks to our wonderful representatives in Congress, particularly Nita Lowey. And we have applied for funds from the Payroll Protection Program, although at this time we are not sure that our bank got our application over to the Small Business Administration before the funds ran out. Fortunately, our board of directors encouraged us to double our line of credit, which we did recently. We're in week 6 of the COVID pandemic and its impact in our communities. We have lots of robust patient and symptom data that tells an important medical story about the plight of people affected. As the story has unfolded here and across the country, it's obvious that groups of people are affected differently by the virus and that health disparities have a huge impact on patient outcomes. Low-income people of color who are over 60 with hypertension and BMI above 30 are at high risk and particularly vulnerable to complications. We are paying very close attention to these patients. Beyond the medical model, there is an important community health story that Open Door is uniquely positioned to address. We understand that low-income people have a particularly difficult time social distancing and face challenges at home in crowded conditions. Many don't have Wi-Fi, making telehealth visits with their doctor difficult or even impossible. The digital divide poses a significant challenge at a time like this. Low-income people need their jobs to be able to pay their rent and support their families. And even though it's required by law, sick time in the gray economy is precisely that, gray. At Open Door, because we have community health workers embedded in our care teams, we are able to provide important health education in a highly culturally competent manner, and as a result, mitigate the spread of the virus in ways others simply can't. Further, we have decades of experience with communicable disease, HIV/AIDS, tuberculosis, and others. We have excellent and necessary clinical data systems and analytics. We have an excellent track record with the CDC, and we understand what it takes to change behavior to prevent transmission. It's block and tackle public health happening right here where we work and live. Our vision is to do a lot more to support the opening of the economy very soon. We'll continue to do lots of testing, and we look forward to having the rapid test that we can process in-house. We also look forward to having the antibody test when it becomes more widely available, hopefully very soon. And while testing is a big piece of pandemic response, we recognize that culturally competent, what we call shoe leather, community health education is essential in stopping the spread of the virus. I hope you will support us so that we can ramp up our efforts on a much broader scale. Thank you for your interest. Your support makes a difference and truly gives Open Door a leg up, especially now. As always, please feel free to reach out to me at lfarrell@odfmc.org. Thank you.